the subjects of second year. So in second year, when you learn these things thoroughly, then we'll go for the assembly part. So right now, nothing. So at least say, if you have started those video lectures from my channel, so then buying BD Chaurasia, that would be pretty good. And right now, what we are discussing, so you can buy Guyton and you can also have the Sambulinga. You can have both of them. Regarding all the attempts, etc., we'll discuss. Right now, we'll not be talking much about non-DSM. Say regarding what I mean by etc., just in simple words, what I said, Sambulingam is where the points wise things are given, and in Guyton, it is like a story. Right?
Can I have one question? Sir?
Yes.
सर अभी सिर्फ ये तीनों ही बुक लेने हैं ना?
हाँ, yes, all three.
Only three.
Yeah.
Okay.
अभी के लिए सिर्फ ये.
हाँ ठीक है सर.
Now, how to get lecture notes? I gave you the link last time, right? I gave you the link last time, and from that link, I got the replies also that yes, you are able to download the PDFs. That would be a common link which will be made. In case if anyone is not having that link, just send a mail to me and I'll send you the link. Okay. All right. Yes, you have to buy all the volumes of BD Chaurasia. So let's start with our now today's topic. Whenever you buy a new book, always go for the latest edition. Right? Always go for the latest edition. So let's do one thing. Now we start with our today's topic, and the point is for the link, just send a mail. Right? Send a mail to me. I'll send you the link. Okay. Otherwise, this thing there is no end. Still, I'm keeping the chat on. Yeah. Keeping the chat on. Okay, coming back to this. Coming back to our. So what is for today? Now see, last time we discussed about. Last time we discussed about the cellular fluids. So in this case, so we'll be talking about the functional integration. So what functional integration is? With this concept, the functional integration. With the functional integration. Right now, we now stop about asking books, right? We have talked enough about that. So please. Email ID. This is the email ID. TILLURMBBS@gmail. Right, at gmail.com. So this is for those who are here for the first time. Otherwise, this email ID has been already shared. Anyway, so let's start with our today's topic again. Focus on this. I'll be sharing the PDF and I'm not sharing the recording, right? Because all the lectures, they are live lectures. So if it is like every time we insist on that, yes, we need to have that video. No, I want you to focus on this. Chalo. So functional integration. So what exactly we mean by that? Functional integration is, one is the theory. We learn the theory, right? Theory is like, say like this, that this is the heart and these are the fourth chamber, these are the valves, etc. Right? That is a theory. But when we say that how this heart is oriented and what will be its effect, why it happens when this chamber it enlarges, person will be having difficulty in swallowing. Now that is something amazing, right? This is left atrium. So that means when we swallow something, so that means it goes into the esophagus, right? It goes into the esophagus. So what if right in front of the esophagus, right, this particular chamber is there. So when it is enlarged, when we watch from the side, it would be something like this, because this chamber of the heart is enlarged and it is giving the pressure symptom, right? It is giving the pressure. It is giving the pressure on esophagus. So when person would try to swallow, he won't be able to swallow, right? This is what is called as the integration. So in integration, in physiology, right, in physiology, in pathology, in pharmacology, in medicine, three things they are very closely associated. One is the respiratory system. Right? One is the respiratory system. Even in your clinical practice, you'll find that so many patients of respiratory system they will come to. Second would be the cardiovascular system. Very closely associated, cardiovascular system. And third would be the most beautiful, our nervous system. And that would be the integration of brain and the spinal cord. So these three systems, right, they will be very closely associated. So there has to be a balance. There has to be a balance. So balance is what our body remains into one state, right? In one state, and that state is the most ideal, most precise state in which body survives. So let's say temperature, right? Temperature. Let's say blood pressure, right? Let's say heart rate, right? Now see, all in all these cases, there would be some normal value, right? Some normal value would be. So this normal value is, if this value is there, you don't have to worry much. That's the reason when you see the blood report, right, you find that yes, things are there which are normal. But anything, if it is not normal, either it is high or it is low, right? If it is high or it is low, so then there is a trouble. Right? B12, we say that if it is low, yes, it is a trouble. But what if a B12 is very high, it is in the range of 2000? Must go for ultrasound of liver. There is something wrong, right? Because B12 should not shoot to that high level. That means there is some problem. So that's why we'll talk about what is called as the homeostasis. Homeostasis. Homeostasis is a beautiful balance. And when this balance is proper, there would be the progress. For our body, there would be the growth and development. Right? It would be good growth and development. Just yesterday, I was talking to my students of USMD. I learned, I was reading one article, and that article it is so amazing. It was about that there is anterior mid-cingulate gyrus. Right? It is called as the anterior mid-cingulate gyrus. Now, this is part of the brain, right? But the speciality of this particular area is that whenever you do anything where you have to take a bit of stress, right? Say, for example, if you find that yes, you are not very comfortable speaking on stage, but you develop the courage and go on stage, and even if you speak 2 sentences, this anterior mid-cingulate gyrus that becomes bigger, and with the help of PET scan, positron emission tomography, and the MRI, it has been proved beyond doubt that those who are like sitting ideally, not exercising, not taking any stress, physical or mental, their cingulate gyrus that is pretty small. But those who are really taking good control on themselves and then they are practicing, their cingulate gyrus that was pretty big. And this size, right? So that's why it is said that where is the success? If this is the comfort zone, right? As such, it was known to us now that this is something which is known to everyone, that if this is the comfort zone, where is the success? Here is the success. Success is just outside your comfort zone. Bus. That's the thing. So this is like a good, say, answer to few of the emails when you started doubting on yourself that will I be able to complete? Definitely. Right? No one has got the extra brain and no one has got 25 hours in a day. Everyone has got the same time and the same brain. Right? It's just like how you use it. So this was what I wanted to share, and I shared it with my USM students also. And I said that don't doubt yourself. So this is like a balance between the various parameters. Now, when we talked about cell, So in entire body, the total number of cells, that number is looping 35 to 40, not million, not billion, it is trillion. 35 to 40 trillion cells. Now these cells, these number of cells, they keep on changing. But out of all these, the red blood cells, 25 trillion. So how important the hematology is? Hematology is study of blood, right? So how important will it become? Now these number of cells, they change with age, they change with sex, they change with race, right? In few race, and they even change with the environment. They change with the environment, and then they change with the practice. The way it is said that if you want to run a marathon and if you want to go for a sprint, you need both the things, because in marathon you are slow twitch fibers. You are making your slow twitch fibers powerful. And in sprint, you are practicing fast twitch fibers, right, of your muscle, because muscle is comprising of both the things. So when that balance comes, you will be able to succeed. So this is what is very much needed. On to the sleep. I have answered in email that yes, I'll be taking all your points during the class. So taking the sleep. In case of sleep, this is the time which is before sleep, and this is the time which is after sleep. 10 minutes, they both are vital. So avoid any of the distractions in the form of television, anything in the form of mobile, iPad, nothing, right? Just stop. And as soon as you wake up, don't watch any of the rubbish things. It happens like, say, when we were in hostel. So at that time, I made a small transistor. So just by joining the wires, it used to play. But as soon as I used to wake up in the morning and then start the radio, the first thing which was coming up was washing powder, the advertisement of washing powder. And it happens like that. This is your sleeping hour. During sleep, you were like a clean slate. Next morning, whatever you put into your brain, right, that keeps on circulating. And for rest of the day, for no reason, right, you are just singing washing powder. And it happens, right? You listen to some Sarasa song, absolutely rubbish song, and then that stupid song, it keeps on playing for the entire day. So this is the time. Kindly don't waste that time. Don't put any kachra, right? Literal word is kachra. Don't put any kachra. It happens like as soon as you check your cell phone, and if someone has sent some nasty message, gone, your entire day is destroyed, right? Don't let anyone take control over it. This is one sentence. I'm repeating the sentence. This is answer to those two emails. And I think you are very intelligent to understand that what I'm trying to tell. Don't let your life be controlled by anyone. Most important is you, and no other nonsense person is as important as you. I think you got my answer. Okay. Yes, I read your entire email at length, and after that only I'm answering in this one sentence, that no nonsense person can take control over your life. So if you have got a television at your place, right, and if there is a remote control, I'm sure it must be having a remote control. Do you give that remote control to your neighbor that, okay, you decide when should we start the television and when should we watch and what to watch? If the answer is no, then it's your life. It's much more important than the TV. Okay? You got the answer. Well, okay, so rude. Yeah, at times I am rude. Yeah, and it was every pill is not tasty. कुछ दवाइयाँ कड़वी होती है तो कड़वी खाने की आदत डालो. My purpose is so that your life is not wasted. I don't care about others, right? I don't know other person. So keep the emotions aside. If you want to become a doctor, ठीक है, simple as that. Next 5 से 6 साल, forget about it is day or night, right? Forget about any of these nonsense things, right? इसने ये बोला, उसने वो बोला. Do hell with that. अभी मैं गाली नहीं बोल सकता, right? मैं अभी गाली नहीं बोल सकता, इसलिए मैं नहीं बोल रहा. Otherwise, I can answer you in a very, मतलब मुंह मत खोलो बस. हाँ, बाकी बिंदास दोस्त, आप अपनी लाइफ को डिस्ट्रॉय करना चाहते हो तो बिंदास करो, राइट? नो प्रॉब्लम्स. आई डोंट नो यू, आई हैव नॉट सीन यू. You have got all the rights. Right? All the best. So anyway, coming back to this, yes, this is the message to everyone. आज नहीं, कल नहीं, साल के बाद नहीं, 10 मतलब 5 साल के बाद, पूरी जिंदगी सबसे इंपॉर्टेंट इट विल बी यू ओनली. बिकॉज इफ यू आर पावरफुल ना, राइट, इफ यू आर पावरफुल, तो से just I'm taking the example, right? Chinmay, right? So when it is like, say, Dr. Chinmay Sahu, right? So Dr. Chinmay Sahu, right? Let's say MD and fellow of Royal College of Surgeons, right? Looks so good, है ना? At that point, will anyone dare to come and say कि hi Chinu क्या कर रहा है, right? No, they'll say अरे डॉक्टर साहब, even those who are your schoolmates, they'll also say अरे डॉक्टर साहब. हाँ, they might say tell you too, but they will be talking with that respect. The point is, as you progress, right, your value increases. And it is not so. See, word is super selfish. Trust me, word is super selfish. Make yourself powerful, not arrogant. But जब बोलना पड़े ना, right? Yeah, thanks, Anjali. Yeah, definitely I'll be thinking about you because you all of you, they are, say, at such a critical stage, such a crucial stage of life. Because अभी से अगर जो इतने powerful बन गए, तो you all will be my soldiers. No one can beat you. And from the long perspective, what we are thinking is that, see, when you'll come back to India and you'll be competing against your current batch, right? Those who are studying in, say, Vishwa Medical College or on the Institute of Medical Sciences or all those, you'll be competing against them. So abhi se shuru karo, abhi se preparation. Okay. Next is, so sleep is very vital. How much sleep? In the sleep topic, we'll be talking about REM and non-REM phase. But abhi ke liye, at least 6 hours. It is said that 8 hours of sleep, but good 6 hours of sleep, that is pretty good. I'll don't mind. I'll share something onto our emails. Okay. So we'll be able to answer all the questions. So 6 hours, right? I'll send you. I'll put one music. Today only I'll do that. I'll put one music, and that I put that music into our schedule, right? And what I'll do is, say, this, I'll make a folder called special. So you'll be able to access this folder straight away. It will be under that only. And in this, I'll keep on putting all such material. Now, this material, it is not necessary that everyone should follow. This is your choice. But this is the music which I usually follow. This is the music which I usually use. Every night, just before going to sleep, I just start that. And it is about 10-12 minutes. And within that time frame, it automatically, उससे पहले तो नींद आ जाती है, and it switches off by itself. So I'll share that. Right? I know it is very effective, and see how effective it is for you. Not necessarily that it is effective for everyone, but try it. Right? 10 minute के बाद The next one, when we'll be talking about, say, in this physiology, when we'll be discussing GIT, right? In GIT, we'll be talking about the digestion, etc. Right? So many things. So digestion, all the various. Okay, Manthan. Just send a mail. Send a mail to me. Yes, and it's a binaural beat. Very nice. Very good question. It's a binaural beat. You are right. Good. I'm happy. So this is the GIT when we'll be discussing about the digestion. But say instead of digestion, think about, I'm telling you one thing. Say antibiotics. You must have seen that people, they take antibiotics. Many of you might also have taken the antibiotics for some reason. And after that, there is GIT upset. Right? GIT upset. At times you feel like that even if the condition is good, right? The illness is cured, but still you feel bada dhila, right? You feel like maja nahi aa raha. You feel weak, tired, lethargic. This is because in GIT there is a bacterial flora. So this is another reason, that is what is called as the functional integration. This is the bacterial flora. In your digestive system, in your intestines, there are some bacteria which are so good. And these are the bacteria which are making B complex. B complex. So this B complex, which is naturally created by those bacterial flora, these bacterial flora, they are killed by those antibiotics, because antibiotics, they are not understanding whether it is a useful bacteria or it is a harmful bacteria. They slaughter. That means there would be deficiency of B complex. Now, if someone has not noticed it, B complex is what? B complex is a water-soluble vitamin. Right? B complex is a water-soluble vitamin. Water-soluble vitamin means it is needed every day. Vitamin A, vitamin D, vitamin E, and vitamin K, they are the fat soluble. So they are stored. Right? They are stored. They remain. It won't happen that within a day the deficiency would come. No, it takes long time to develop that deficiency. But in case of B complex, yes, the deficiency is evitable in just 1 or 2 days. And supplements on no. Weight gain is a different thing, but B complex, nothing to worry about it. Right? So B complex tablets, yes, they should be taken. They not should, but they must be taken. So whenever, this is like as if I'm teaching pharmacology. So whenever you give antibiotics to your patient, you will be giving 2 things. One, B complex, 1 tablet a day. Now there are so many available Bacosutes, Bacozymes every day, right? So this is for the patient. Now I'll be coming to you, right? So this is for the patient. You'll be giving 1 tablet per day, and that should be taking care of it. Second, because these bacteria, they are destroyed, so those bacteria, they should be replenished. That means they should be brought back so that the natural production of B complex will start. And after about a week or so, you can tell the patient to stop that B complex tablets. So for that, you need to tell them to take, say, it is what is called as the Sporlac, Spironolactone. The Sporlac, these tablets, right, the Sporlac, they will be generating. They are just a combination of those bacteria. So when they will be established into your gut, and then they will go for the natural production of B complex. This is not costing even 100 rupees, right? Not even 100 rupees, but it is so beneficial that your patient will be absolutely comfortable, right, during that treatment. Now for you, as a student, right, you'll be utilizing your brain very powerfully. We never know, because our food habits, if they are not very proper, the deficiency of B complex, that is, within no time it develops. And suddenly you will feel, as you asked, that even after 8 hours of sleep, you feel tired, you feel lazy. The morning is not that fresh. Right? You don't feel like, chalo bahar jaake, let's hit 10 kilometers. Right? Ke chalo 25 kilometers cycle chala ke aage. Ke chalo 40 length mari swimming. No, it never happens. Right? Or by the end of the day, if you are absolutely exhausted, do one thing. Start B complex. Anything is fine. Bacozyme, right? Say vacozyme C forte. So this is like B complex plus C, vitamin C together, right? Vitamin C is good because it will be improving your immune system, right? So vacozyme C forte or vacosules. So they are all good. Can be taken, right? Just one tablet a day, and that will take care of it. Whenever you are comfortable, right? I told you about some of that because looking at, there is a third report also, and I can see that. So at least your basic blood reports, right? वो definitely आप करवा लीजिए. If not more, just one CBC, vitamin B12, and vitamin D3, right? Just a minute, just. Hello. Yes. Be fast. What do you want? Yeah. No, not needed. Don't disturb. Don't disturb. Seriously. Someone called up for the loan and he has called up 7th time. So I thought there is some emergency. Horrible. How to adapt to cold temperatures in Russia? Exercise, everyday exercise. And over there, say, everyone should take omega-3. This will be very helpful. And basically, it is a fish oil. So that very long question. So just send a mail. I'll reply to it. So this is something which is basic. Right? CDC is common blood count. For mouth ulcer, yes, B complex is very much because that is one of the first manifestation that things are not going good deeper into the body. That's right. Okay. So we talked about ECF, extracellular fluid, and intracellular fluid. Correct? Yesterday, last time we talked about it. So that is where we said that this is something which is extracellular, it is in plasma, right? Plus interstitial fluid. One of the question that what's the difference? Plasma is in blood, and interstitial fluid that is into all the surrounding sources, right? All the surroundings. That means that these are the cells, the entire body, and the space which is in between. So that is, say for example, muscles. The space in between the muscle cell, that is what is called as the interstitial space, and that space is having fluid, and that is called as the interstitial fluid. So interstitial fluid is between the cells. So anything other than blood, that is what interstitial. And ICF, that is what is inside the cell. Inside the cell. Last time we discussed in detail about all those conditions. Right? And when we said that such a big portion is of blood. About the ions, next time we'll be discussing the sodium potassium pump, right? So sodium, this is into extracellular fluid. Chloride, this is into extracellular fluid, right? Plus there will be glucose, there will be some amino acids, all those things will be there, but these two will be playing a crucial role. You remember? In case of intracellular fluid, this is the potassium, very vital, right? There will be magnesium and the phosphate. So when I said to one of you, when you check your blood report, there is decrease in sodium, and then there is increase in potassium. Now these values, they are like laser sharp, right? They are very strictly maintained. They should not vary, right? So when there is increase in the potassium into the extracellular fluid, right, this potassium is inside the cell. Think it like this. So this is the cell. The potassium is over here. Next time we'll be discussing sodium potassium pump, that how this whole thing is balanced. If this pump is not working properly, that means this potassium is going outside. When it is outside, so that means it will push the sodium inside. Now it happens like that this is the potassium, that potassium which is outside, right? It is into extracellular fluid. Extracellular fluid, that means this is what is called as the hyperkalemia. Hyperkalemia. Now, hyperkalemia, the moment there is hyperkalemia, this is one of the things which is for cardiac arrhythmias. That means heart starts beating in a different rhythm. We'll be studying this thing in extensive detail in physiology because it is the normal physiology and it is necessary to understand it. So, why that thing occurs, I'll be replying you in email. But any of such variations, don't take note. And that's what I said, that I'll be answering in detail and it would take time. So by tomorrow, you'll get it. Opening and closing of sodium and potassium gate channel. So basically, it is like those channels, right? They are there, but the point is that it is the pump which is constantly working, and it is a very dynamic process. It is a non-stop process. It works for the whole life. Right? It works for the whole life, non-stop. Okay. Same thing is for temperature also. Another question, which was like, we have got 5.5 liters of blood. 5.5 liters of blood. So whether someone is weighing 100 kilograms or if someone is weighing 60 kilograms, this remains same. Almost same. Hardly there is any much of the variation. This remains completely same. But the point to understand is, can anyone donate blood? Blood donation? Yes, you can. Subject to that hemoglobin. Hemoglobin level should be proper. The pump is in every cell. Yes, pump is in every cell. Every cell of the body, and it works non-stop. It works non-stop. That's how the homeostasis is created. Right? That is the balance. So in case if then there are factors which will be affecting that pump. So if that pump is not working properly, there will be major changes. Right? So either the pump is working more or the pump is working less, and that can lead to major changes. This is, we are talking about the blood. So anyone can donate the blood, that's because it is 5.5. Till say 15% of the blood is lost, your body survives. Because you donate the blood, immediately liver would replace it. Right? Liver would replace that blood. That's okay. Now there is less blood into the stock. So if anything happens to that person, so then there might be some trouble. But still, there won't be any trouble because the amount of blood which you donate is 375 ml. That's not even even 10%. 10% is 550 ml. This is much less. So you are donating about 5%, 6% of the blood. Nothing happens. To test this thing, right? I have donated 108 times. And in one of the occasions, after donating the blood, immediately after donating the blood, I went for a test marathon run. Ran 42.1 kilometers immediately after donating the blood, and then there was no problem. Everything was fine. You don't even feel that weakness. And in fact, if you keep on donating at a regular interval, your liver will be in best of its form, best of its state. Okay. Next one. Now, this is very important. In case of heart, Heart is that pump which pumps the blood 5.5 liters every minute. Every minute, and this blood is circulating into the entire body. Actual meaning of doctor's logo? Well, actual meaning of doctor's logo, right? That is to take care, right? That is to take care. Right? In detail, I'll let you know. I'll put the logo and then explain. Some experience unconscious after blood donation. Yes, it happened with one of my friends just recently. It happens, say, either just by watching the blood, लोगों को चक्कर आता है, right? देखने से, or even if someone is having hypotension, hypotension is when the blood pressure is low. If the systolic and diastolic, right? So systolic and diastolic, if the diastolic blood pressure is in the range of 60 to 65, normally we say that blood pressure should be 120 by 80. This is diastolic. If diastolic is low, diastolic is that minimal pressure which is always present. So when the heart beats, right, the blood is pushed, that is systolic blood pressure. When the heart is relaxing, but still there is some pressure, right? So that is diastolic pressure. When the pressure decreases so much, so that leads to decrease in the brain perfusion. The amount of blood which is reaching to the brain, that reduces. Now, brain is super sensitive. Immediately, it will send the signal. So what that person is doing, it is like fainting, etc. So that person won't do any of the movement, will just lie down, and brain will say, okay, as you lie down, so the blood would start circulating towards the brain. Right? How it happens, we'll see that. But our system is designed in such a way that brain is to be protected first. Because if anything happens to the brain, there is no way out. Second, right? So there is also one of the conditions which is called as the postural hypertension. Postural hypotension. Postural means when the person is lying, everything is fine. As soon as he stands up, and then he finds that dizziness, chakkar. Postural hypotension. When the posture changes, there is decrease in the blood pressure. So when they are lying, they are donating the blood, everything is fine. As soon as they say, "Acha boss, all good, stand up," and then they start getting that feeling. But otherwise, normal. If anyone donates, no problems. It is good. But for the heart, always consider that heart is like a cashier. Right? You have seen in the bank the cashier. That gentleman, right? So many crores and crores of rupees are going through his hand. Right? Someone is coming, depositing large amounts, someone is withdrawing. But he has to survive in his own salary. This is the best example of what the heart is. Right? Heart survives by its coronary circulation or the coronary supply. Coronary arteries, these are the arteries which are giving blood to the cardiac muscle, which are giving oxygen to the cardiac muscle. And it is this coronary circulation. So you must have seen that there is right coronary artery, there is left coronary artery, there is left circumflex artery, right? Then there is left anterior descending artery. All these names, if you have seen any of the, say, coronary angiography reports, so these will be the names. Right? So these will be the name. And these are the arteries which are really supplying blood to the various chambers. And when we say chambers, so it is not that hollow part. The chamber is made up of, right? Chamber is made up of musculature. That is the heart. This is the blood which is over there. So that is the blood which will be pushed. Coronary is supplying blood to this musculature. So it is these muscles. When they contract, right, then blood is pushed out. This blood is of no use for the heart. Is of no use. Blood can't, heart cannot use that blood which is inside the chambers. Heart can use only that blood which is getting supplied to it by coronary arteries. And those coronary arteries, they are getting that 5 ml, 10 ml, very less blood. So heart is doing dedicatedly for whole life in that small salary. What is the importance of this? Why we talk about it? Because when I saw the blood reports, there are few reports which can affect this. High cholesterol, high triglycerides, high LDL, low HDL, high density lipoprotein, low density lipoprotein. But you can remember that HDL is like healthy and LDL is like lousy. Lousy means bakwas. Right? Whenever you buy anything, just see that there would be unsaturated and there would be saturated fats. It is mentioned. Right? It is mentioned. Think it like unsaturated. Unsaturated means uttam. Uttam means, right? In Hindi, uttam means best, right? Ekdam badhiya. Don't start any of the unnecessary things. I don't know why someone is so interested. Simply don't touch the screen and focus. Saturated means sada hua. You'll find that in many of these outside products, the saturated fat content that is so high. So this is what really affects this coronary circulation. And this is one of the main cause, Ashish. This is one of the main cause for heart attack. Heart attack is nothing but its name is myocardial infarction. Infarction. So how the heart is not getting the blood when the heart has got so much of blood in it, that blood is useless, right? Because those coronary arteries, they were narrowed. They were narrowed because of all these junks, and their caliber kept on decreasing and decreasing and decreasing. And one fine day or one bad day, not really the fine, one bad day, that person's this coronary artery, it got blocked. There is one artery which is called as the LAD, left anterior descending. The other name of this artery is widowmaker. That's a name. Do you need to remember all? Today's session is just enjoy, right? Even if you don't remember anything, it is fine, right? It's fine. But just what I mean to say is that yes, this is integration means that all these things, they are associated with each other. That means that say we were talking about blood, but yes, it will affect the heart. This is how it will be affecting the heart. Left anterior descending. This is anterior, right? Anterior descending. So it is called as like a widowmaker. You can ask the questions, right? Say when you asked about the varicose veins, right? These are the veins which are under low pressure. Veins are under low pressure. And here is the vein, here is a normal vein. Now there would be valves, right? There would be valves, so that when the blood is going in one particular direction, right? So that blood should not come back. Say for example, lower limb. When the arteries from the heart, they are going towards downside, they are with tremendous force. But when the veins have to take the blood back into the heart, right? So here is the heart, here is the lower limb, right? Also lower foot. When the arteries, they are coming, the blood is coming with force. And then there is uphill. It has to go all the way up. So there would be various valves. So these valves, they will be telling that yes, blood will keep on going into one direction only. When these valves fail, then there would be blood will be falling back. Result, this particular vein, that will become tortuous. Right? It will become tortuous. It is because of the pooling of the blood. That is what is called as the varicose veins. Right? Varicose veins. Now for the right? This is for the cardiac circulation. This is right atrium. This is left atrium. This is left ventricle. And this one is the right ventricle. The journey starts. You can start the journey from any point. So let's start with left ventricle. From left ventricle, there goes the biggest artery, and that is the aorta. Very powerful aorta. From aorta, it goes into, right? Now the aorta is like an arch, right? It's like an arch, and it divides into various parts. So some of the arteries, they'll be going for head and neck, and brain, and some of them, they will be going for the abdomen and the lower limb. So they will be supplying oxygen to them, because we can say it like L is pure, right? LEFT, pure. RIGST, more alphabet, so this is impure. And it is, we say impure means this is having more carbon dioxide. This is pure, that means it is having oxygen. So this blood reaches over here, and it is oxygen is supplied. This oxygen is utilized, and then it will be loaded with CO2, carbon dioxide. So from here, it will come back to the heart. Now it will be coming back by two paths. Right? It will be coming back by two paths. They are called as the vena cava. Blood which will be coming from the brain, head and neck and brain, right? From the top, that is by superior vena cava, and from the lower limbs and abdomen, it is inferior vena cava. So superior and inferior, right, to vena cava. Now this blood is having CO2, right? Deoxygenated blood, superior and inferior, that's right. Then there is a valve. This is a valve. This valve, it has got cusp. This is called as cusp. This, right? They are called as the cusp. Cusp means cup, right? Exactly, bicuspid and the tricuspid. So this is having three cusps. So think it like that they are like this when the blood goes, right? So then between these cusps, they are like this, and then the blood goes. When the blood tries to go back, these cusps, right, they will be tightened and the blood will be trapped. The blood will not be allowed to go back. So that's why it is called as the tricuspid valve. A valve with three cusps. So it will be with the three cusps. So this is the tricuspid valve. Blood will come into the right ventricle. From right ventricle, the exit path, it is the pulmonary trunk, right? And then it divides into right and left pulmonary artery. So I'm just writing pulmonary artery. Otherwise, it is like a big artery, big trunk, and then it divides into right and left. So here, for our ease of understanding, this is pulmonary artery. Now, any of the artery which is going, artery means heart to the organ, but this is the artery which will be having CO2. So normally from heart to any of the organ, this is consisting of O2. Pulmonary artery is the only one, and in fetal life, there are few arteries. So otherwise, this is pulmonary artery which will go to lungs. Lungs will take the oxygen, take the carbon dioxide and will give the oxygen, and then this oxygenated blood, that would be going all the way into the left atrium via pulmonary veins. So these pulmonary veins, they will be having oxygen. Then it will go to left atrium. Via left atrium, it will go into this valve, and this valve is called as the mitral valve. Mitral valve, right? It is called as mitral valve, which is a bicuspid valve. And then from mitral valve, it will go to left ventricle and the journey continues, right? And then on to the left ventricle and on to the aorta. This is what is called as the normal cardiac circulation. This entire circulation is completed in 0.72 normal, right? 0.8 seconds. How 0.8? Because normal is 72 beats per minute. So when you divide it by 60, so the answer will be 0.8. So that is the time for one beat. This is 0.8 seconds. Emphasizing it on this, when you put the stethoscope, the sound, right? You hear lubbed up, right? That is what is classically called as the lub dub. Sorry. So this lub, this is very vibrative sound. So lub and dub is dub, right? This dub is a dull sound. Sounds are produced only when the doors are closed. Sounds are never produced when the doors are open. They are open. So this lub and dub, these are the two sounds, first heart sound and the second heart sound. These sounds, they are produced only and only when the valves close. When the valves close. When the valves open, there is no sound. There should not be any sound. But the valves, but there is something what is called as the murmur, right? There is, it is 60 by 70. That's right. That's 72 beats per minute. So this is like in 60 seconds, how much, right? So it will be 60 by 72, and that will be required. You're right. So coming back to this, that when the valves close, at that point the sound is produced. So now, when the valves open, there is no sound, correct? There is no sound. Take a tube. So when we run, the beats can be more. Yes, it will be way high. It can reach to 150, right? 150 beats per minute. That is when the heart is beating so fast, right? So when it is 150, now imagine what would be the, in how much time it is taking for one beat, right? Because this will be 60 upon 150. Massive, right? Even if you give, this comes to what? 1 upon, this will be 2.5. 1 upon 2.5. Such a small number. Such a small number. So due to all these things, it will be beating so fast. But the point is, it is not this. The point is that when you are putting the stethoscope, so within 0.8 seconds, one beat is passing. So this is lubbed up, that is one thing. The second, when you hear the murmur. So what is murmur? When the heart beats, the blood goes through those valves. If the valve is fully open, no problems, there won't be any sound. Take this example. Take a tube, water tube, right? And then the water is going, right? There is no sound. Then what you do is you try to pinch this. Right? You try to pinch this, squeeze that. And now you'll see that that sound will appear, correct? But that is the murmur. This is nothing but a murmur. Murmur means it is that sound which is happening because of the turbulence. Turbulence. So turbulence is when the fluid, it rotates, right? Because of the less space availability, it generates a sound. And that thing will be the murmur. Now this murmur is occurring, it can occur because of many of the places. Let's come back to this. What if this mitral valve is narrow, right? So the narrowing of the valve is called as the stenosis. So when the blood tries to go over here, this is where it is getting turbulation, right? So this means this is when the atria contracts and when the ventricle blood is coming to ventricle. This is right. How to know that our heart is healthy? So one, that's why I said that you buy a stethoscope, start listening. All of your hearts, they will be very healthy. Right? Not there shouldn't be any problem, because there would be specific symptoms when anything goes wrong to the heart. But this is the understanding that when you listen to this murmur in case of patient, right, any of the extra sound, so that extra sound always carries the meaning, right? Or say, so this, right, visualize this: left atrium, left ventricle, left atrium contracts, and then there is a sound, right? Left atrium contracts, and then there is a sound, right? So this means when the blood is passing through the mitral valve, and then there is a sound. So that means this would be the mitral stenosis, correct? But then there is one other condition which is called as the mitral regurgitation, right? There is regurgitation. So regurgitation is what? When this valve is unable, one is the stenosis is that this valve, right, instead of this much opening, right, this valve is so much narrowed down that there is very less opening, and blood is passing through that improperly opened valve. It is giving the sound. Or in some cases, it is so loose that it is even allowing the reverse direction. So blood is going from left ventricle onto the left atrium and it is allowing it. Now this is abnormal, right? So that's why there will be turbulence over here. So that sound will occur when the left ventricle would contract, correct? When left ventricle would contract, it will try to go up. And if it is going up, that's where you hear the sound. So see the difference. Same valve, but they are giving different type of sounds at different point. One, when the left atrium contracts, other, when the left ventricle contracts. So this is how things really go. So this is just for the understanding. So this is just for the understanding that this is what you'll be learning. Stethoscope is given. Okay, that's nice. Someone is very thoughtful in giving you the present of stethoscope. So can we hear murmur sounds if there is regurgitation? Surely we will hear the regurgitation, because those flaps, they are like not normal, right? So if they don't stop the blood, so that blood that would be turbulating, and the sound quality that would be totally different in case of stenosis and in case of regurgitation. So we have got now 4 valves. Imagine we have got 4 valves. So this is, and any valve can go wrong. So right over here, schematic diagram. So this one, as we said, this one is the mitral valve, right, which is bicuspid. Similarly, there would be one valve, that valve which is this is aorta. So that's why it is called as the aortic valve. Similarly, this one would be the pulmonary valve. Pulmonary valve. And this one would be the tricuspid valve. Now, every valve can go for stenosis, and every valve can go for regurgitation. Suddenly, your whole perspective would change. Right? The semilunar valves, that's right. Right? The whole perspective would change, because every valve can go wrong. Any valve can go wrong, and in either of direction. It can be stenosis, it can be regurgitation. And when it comes to diagnosis, this would be making all the difference. So there would be a specific plan that this is how you will be coming to the diagnosis, and that is what is called as the differential diagnosis. In some of the cases, it will be so evident that you will see the patient and instantly you will say. Not only that, there can be septal defect. this is right atrium, left atrium, and this portion, if there is any gap in, जो कई बार कहते हैं कि heart में hole है, so hole is not anywhere in the wall of the heart, but it is between that septum which is between the chambers. So that hole is there, right? Because of that hole, the carbon dioxide blood, the oxygenated and deoxygenated blood, they keep on mixing. So that depends upon where the hole is, what stage, so many factors, but that comes under congenital heart disease. So see how they are connected. In some of the case, when the size of the hole is small, person would not notice it. But as they grow older, when the demand of the blood increases, this defect causes problem, and person starts feeling tired, and then there will be so many complications in the form of, we'll see it in detail, it is called as the Eisenmenger complex, in which this cardiac system, that would be affecting the respiratory system. Respiratory system. And you come to the conclusion when you are checking the respiratory system that yes, there is problem with the heart. Right? Can we differentiate which valve is affected? Precisely. You can, with the help of auscultation, so many modalities are there, but yes, you can identify which valve, whether it is stenosed, whether it is regurgitated, which wall is affected, how much it is affected, all those things. Yes, it is very much possible. Today's session is for this purpose only, this understanding that yes, so many disease, yes, that is what is called as the differential diagnosis. Right? Differential diagnosis. If you want to become a genuine good doctor, learn this. Learn this. Can we identify the reason for headache? To identify the reason of headache itself is a big headache. That is the sentence written in one of the very reputed book of medicine. And actually it is. It took us about 5 hours to finish the topic of headache. Yeah, 5 hours. There are so many reasons. Right from the simple stress all the way to the various nuclei, various types of hemorrhages, how to detect them. Right? It's amazing. But that is what has been written. Right? So what I'm telling is that today's session is only for one purpose, that in your mind you set this concept that yes, I'll be the person whose differential diagnosis will be best. Because that's where you'll be integrating everything. You'll be combining everything. It's like you are asking the patient that yes, what do you do? Right? And then the patient is telling something, but then you see that his neck veins are engorged, right? Neck veins are bigger, his hands are shaking, right? So that is giving you the clue that what has happened to him. Why the neck veins are so engorged? Because there is no valve, right? In the superior vena cava, there is no valve. So the blood drains directly to it. It is this chamber would be the right atrium. And then there is inferior vena cava. In inferior vena cava, there is valve, so the blood comes over here, and blood over here, it falls like a waterfall, right? Straight away from here, all the way, it goes into the right atrium, right? Via this superior vena cava. And that also, right, there is subclavian. This is how they will be joining. So when it comes straight away, so you will be able to figure out that this jugulars, right, that how much is the jugular venous pressure. And if it is high, so then it is the back pressure. And that back pressure, this is the right atrium, blood which is going from right atrium to right ventricle. Right? There is a valve over here. So if there is a valve which is stenosed, that means there will be more pressure into the right atrium. That right atrium pressure, that would be backfiring all the way up, and you will be able to see the engorged vessels, big vessels, right? Tedi medi, all those veins. You'll be able to see that. Many times you see this. And when you go to, say, some civil hospitals, you'll find so many patients, right? And then these are like spot diagnosis. You just see that, and then that thing should come in your mind. Right? So this differential diagnosis is for that purpose. When the patient is walking, right? Even if it is relative of the patient, and even sometimes when we go for run, right, we find out that this particular person, the way he's walking or the way she is walking, right, putting pressure on one leg, chances are high, looking at the age and the way the skin is looking like that this person, it might be the avascular necrosis. So many of the diagnoses, they are like spot diagnosis. So, and if you see that, yes, person is wearing a shoe where one shoe is bigger, second shoe is smaller. So that means he must have undergone the surgery and there is a shortening of the limb, and then that has been adjusted with the help of that foot, right? Artificial footrest. Yes, varicose veins, they are mostly, they are always visible on veins because it is the tortuous superficial veins. Tortuous superficial veins, they are saphenous. They are there. Saphenous and short saphenous, long saphenous, short saphenous, they are the veins which are, and they are visible. Yes, you'll be able to see them very crisply. So this is the purpose, differential diagnosis. So time to time, as we'll proceed, many times we'll be talking about the pathology part also. Pathology part also, we'll be talking about some of the pharmacology part. Though I know you are into first MBBS, but that doesn't mean that you should not. Right? Say, for example, the cost of this sorbitrate, the cost of this tablet is 6 rupees. 6 rupees. This is the cost for 10 tablets. Right? It is that cheap. But this sorbitrate, everyone should keep at least, if not more, one strip into their house. Any day, if it happens, like if there is any elder, right? If they say, "Yaar, I'm uncomfortable, dard ho raha hai," right? There is pain. Give one sorbitrate. Tell that person to chew it. Even if your diagnosis is wrong, you are not making any harm to the patient. One of my very good friends, in fact, it's HDFC bank manager, right? Very good friend of mine. I met him on Saturday. He said, Sunday, chaliye sir, I'll be coming for 21 kilometers run with you. I said, no problem. Right? We meet tomorrow. Next morning, I waited for half an hour, but then I thought that he must be sleeping, so I didn't call him. Anyway, whole day passed. On Monday morning, I called him up in the bank, and then I was told that he's normal. He passed away. Why? Because the massive heart attack was in progress and no one was knowing. His age was hardly 40. Right? And the relatives and other people, they said, we thought it must be gas. It must be. But if the patient, if this is what is called as the precordial. Precordial is when you take your hand, right, and put it on the left side. Right? When you say, so that is the precordial. Precordial means that area, just behind it, there is heart. If the pain is going towards the left shoulder, if the pain is going towards the back, if the pain is going towards the jaw, right? Remember, it is not only the left shoulder. So there is precordium, right? It's called as the precordium, and the pain is going towards the left shoulder. Left shoulder. If pain is going towards the left jaw, if it is going towards the left scapular region, right? Scapula, right? This back. If it is going, be alert. If the patient is breathless, if the person is breathless, right, there are all the chances that person is passing through the stage of myocardial infarction. At that point, this tablet, take one tablet, tell him to chew, because at that point he is conscious, right? Just chew the tablet. Immediately you do this, you are giving yourself 30 minutes window. 30 minutes window. Because this is like a cardiac tonic. Immediately it will dilate those coronary vessels and blood will start pumping into the area. So he'll feel relaxed, right? Give second tablet. Give second tablet. No need to chew, let it dissolve. Give the second tablet and then rush to the hospital. Take him to the hospital. All they need to do is this for angiography, and then you have saved one life. Cost 1 rupee 20 paisa. 1 rupee 20 paise. This is arbitrary. So very, very important. Aspirin, etc., that you can give later on. Right? This is like an emergency, something which should be kept in the house. Right? When to give second tablet? Well, say this will give you 30 minutes. Right? And second tablet, as you find that yes, patient's health is improving, give the second tablet. There is no side effects, nothing. So that's what I'm telling. Even if you are wrong, right? It was gas, right? It was gas, but still it won't harm you. You have given the one tablet, it won't harm him or her. Nothing, no side effects. Because you are not giving 10 tablets, one tablet, right? No problem. Should always, this is compulsory. I tell all my friends, my entire circle, I always say 6 rupees kharch kar. Even if it expires, right? Expiry date chali gayi, phek do, dusri le. You never know that when it will save anyone's life. So very crucial. As we'll learn the then acidity, तो you are smart enough to treat, right? Kitni sari cheezein, everyone knows. Acidity is dangerous only if it's persistent. Then you have to investigate. You have to investigate it, and then you have to, even from the acidity perspective, we'll see that there are two things. One, is the acidity happening before food? That means as soon as the food is taken and the acidity is gone. So then you are dealing with the stomach, right? There is gastric ulcer. You are dealing with the gastric ulcer. Person has taken food and then the burning is started. That means you are dealing with the duodenal ulcer. Because food has come, secretion has started. By the time, this is the stomach, by the time when this sphincter opens, but the signal has already gone, so there is secretion and it's started into the D1, D2 part, that is the first, second, third part of duodenum. And if there is any ulcer, so that will stimulate, that will lead to pain. Right? So this is like a differential diagnosis. When anything bad happens and then it gives pain. Sorry. This is because, say, at times there is a nervous system involved. Right? There is a very powerful nervous system involved, which will be taking care of the thing what is called as the sympathetic and parasympathetic system. What makes a person dizzy? That is what is called as the postural hypertension. Postural hypertension. Okay. So regarding the control which we are talking, in controls, you have to understand two things. One, what is called as the positive feedback and the negative feedback. Negative feedback, that means it is not bad, right? It is not the feedback what we give. The control systems are, that's you, right? You start eating whatever you like, that favorite dish. So initially you'll feel good, right? And then as your stomach starts filling, stomach is filled, there would be an impulse which will be going that stop eating. This is what is called as the negative feedback. It means what? This is the process A, this is the process B. A triggers B, but as the B is initiated, B will stop A. B will stop A, right? So this is completely normal. In our body, this is the mechanism. Say, for example, if the blood pressure is decreased, right? Blood pressure is decreased. So when the blood pressure is decreased, there are baroreceptors. Baro means pressure receptors. They are called as the baroreceptors. Pressure receptors. So they will detect that there is decrease in pressure. Jao jaake heart ko bolo pump fast, right? And immediately the heart will start beating faster. right? So that the pressure is maintained. So here is the heart, right? Heart beats fast. So when heart beats fast and more blood is pushed, and this blood pressure will start rising. When this blood pressure starts rising, right, these baroreceptors would say, "Ha, now it is okay." They will tell the heart, "Acha, acha, blood pressure aa gaya," right? Stop, stop, stop. Right? So heart will say, "Okay, slow down." It will slow down. This is negative feedback. So negative feedback is, as one situation is done, right, it will start slowing down the first one. So thus very intricate balance is created. The dangerous situation. The dangerous situation is positive feedback. A triggers B. B triggers A. So A is increased, leads to increase in B. B triggers A, more rise. A triggers B, still increase. B triggers A, still high. This becomes still high. Leads to death. So that is what is called as the threshold. Beyond certain level, body breaks and it goes into the positive feedback. So it keeps on deteriorating on and on and on. So things, they keep on worsening. So that is what is called as the positive feedback. So positive feedback, they are normally dangerous. Right? Negative feedback, remember, it is for the homeostasis. All right. So this is what was in my mind, just to explain. Let's see physiology. From next time onwards, next time we'll be learning about the cell membrane. So in cell membrane, we'll not be restricting ourselves to cell. We'll be taking cell membrane along with the receptors. So we'll be going into the depth of the receptors, that how they really function and what exactly are they. So that we know that it is the cell in which there is the entire world, and these receptors, how they will be working on various systems so that homeostasis is maintained. Last lecture, there is no specific link for the last lecture. All the see, I'll just share this link. I'll share it right now. It is this link only, right, which I'll share, where all the files will be placed. Right? So even last time's file is already present. Just give me a minute. Let me share this thing. Just a minute. Just. No. Wait. Just. This is the link. 2-3 messages came for aaj ke lecture ki link, and then there is no extra link. This is the link where the file would be placed. Right? This file would also be placed. So our all files, they will be placed into this particular folder. So I have shared it. Still, if anyone has got confusion, you can just send a mail. I'll reply and we'll give you the link. But this is the link which will be the constant connectivity between. And say I am just creating one folder right now. So you can just even check it. Right? Creating a new folder. The name of the new folder is passion. Right now there is nothing into it. So, but you can just check it. Can you see that folder special? It's not opening. How? Only 2 persons are telling that it is not opening. Otherwise, yes, opening, yes. Ishita, yes, Shweta, yes. That folder is empty. That folder is empty. The file which is present day 2 cellular fluids clinical, that is the older one. Right? That is the older one. What I mean to say is, say there is a folder called special. I'm just putting one random file. Just I put one document. Just putting one document. Just check it if you see it. Yes. Yeah, actually. So this is the place. In special, whatever the things which I'll put, they will be like music, or if I come across some good article, things which I feel like that yes, I should share. It's not opening. We click, it comes out of apps. Just put this link into the browser. See, Chika, it should be try to do that, because if everyone is able to open, I can resend them. It's opening. Good. So what I was telling was that next time we'll be talking about cell membrane and the receptors. Today is Saturday. If you are following this, that is the 3 liters of water a day, right? Or say 3 minutes of workout, just 3 minutes, not more, right? And 30 minutes, no, that is the digital sannyas. This was our expectation. Yes, I'll talk about LED. So this was our expectation. If you are not following, or if you're following it initially and now you have, for some reason, you have stopped it, start again. This will make a big change. Anyone who is still doing it, right? I didn't ask you in the last week. So anyone who is still sticking to this rule, 3 liters of water a day, 3-minute workout, very good. 1, 2, 3. In case you are honest. Yeah, 4, 5. Oh, that is far better. Nishan, 3 liters a day, 15 minutes workout in 2 hours. And every day, right? I hope you are talking about every day. वाटर वाला थोड़ा रह जाता है, happens. कोई बात नहीं, मतलब आज से थोड़ा शुरू करने से. So that means so many of you are doing it. Very nice, happy, very happy. Acha, regarding this LED, see, I'll explain this. So this is aorta. This is aorta. From aorta, there comes the left coronary artery. Right? Left coronary artery. This artery, it goes down, and then there is one which winds around. So over here, the heart is something like this. Right? Heart is something like this. This is the shape of the heart. Now it is this left anterior descending. It is on the left side. So either draw like this. Right? So this one is left anterior descending. This left anterior descending, this is one of the very important artery because it is supplying what? It is supplying the most vital chamber, left ventricle. Left ventricle, right? Not only that, it is supplying plus ventricular septum, interventricular septums. What this interventricular septum? If you really consider the heart, the top view, if you watch the heart from the top, then we draw the heart like this. This is anterior, this is posterior, right? So this means this is left atrium, left ventricle, right ventricle, the right atrium. This is left atrium. Left atrium is posterior. Just behind over here, there is esophagus, right? So this is the reason when the left atrium is enlarged, it will be compressing the esophagus. This is where, that's the location. That's the location for this LAD, left anterior descending. So over here, this portion, this is the septum which is between left ventricle and right ventricle, and that is called as the interventricular septum. Ventricular septum. Now, slight imagination. If this is the interventricular septum, right? Imagine on one side there is right ventricle, other side there is left ventricle, and then this is the anterior part and this is the posterior part, correct? So they are like chambers. Think in 3D, right? Think it in 3D. This side, this is my right side, right? So right ventricle, this is left ventricle, and this is the septum which is in between. This paper is the septum. So there is anterior and then this is posterior. So if I divide this paper into 2/3 and 1/3, that is anterior 2/3, then posterior 1/3. That means this is the septum which is between right ventricle and the left ventricle. And if I divide this paper like this, right? So in which this part is posterior and this part is anterior. So this anterior 2/3, that is what is supplied by LAD, this portion. This means this left anterior descending is supplying the interventricular septum, plus it is supplying the left ventricle. Now, left ventricle is that chamber from where? From left ventricle, there goes the aorta. So if anything happens to left ventricle, that means first thing what would happen, that the left ventricle won't be able to contract. That means the blood will not go into the aorta. Blood will not go into the aorta. Here is how we draw the aorta. This aorta is like this, right? This is what is called as the ascending aorta. This is arch of aorta, and this is the descending aorta. So descending means it is going. This is big aorta. Now, so now this aorta, this side is right side, this side is left side. Over here, brachiocephalic trunk, right? There goes the common carotid, and then it goes into the form of subclavian, right? This is the subclavian. This is common carotid, big artery, common carotid artery, right? The most important artery. And over here, this is not to the proportion, just for understanding. This is on the right side. This is the left common carotid artery. And over here, this is the left subclavian artery. Now the game starts with this. These common carotids, as they go up, they will be dividing into external and internal, and that internal carotid artery will be going all the way up, and then there would be the vertebral artery. So in the brain, that is what is called as the circle of Willis. So from here, vertebral artery, right? The vertebral artery, they form this basilar artery, they divide, and then from top, there comes the internal carotid. It gets divided, anterior and middle cerebral, and then there is a anastomosis, right? Anastomosis, anterior communicating, and this whole thing is called as the circle of Willis. Circle of Willis. That's a very special blood supply to the heart. Now, the moment the blood is not going from here, right? So it won't go into the vertebral arteries, because vertebral arteries, they are just emerging from here, right? From here. So no blood here, no blood here, neither from anterior nor from posterior, the blood is going. In the brain, if you see in the brain, that's the cerebrum, right? And then there is a midbrain, and there is pons, and then there is medulla oblongata, right? There is cerebellum. It is this medulla oblongata, because it is oblong, right? Oval. So that is medulla oblongata. This one is called as the pons and the midbrain, right? So the collectively, this is called as the midbrain. Collectively, this entire thing is called as the brain stem. So many cranial nuclei, they are present over here. But in medulla oblongata, one of the vital thing, and that is the respiratory center. It is our respiratory center. It is this respiratory center which is the autonomic system. Because you don't have to remember that, yes, I'm supposed to breathe in, breathe out, breathe in, breathe out. No, respiratory center, this is taking care of it. Unfortunately, when the blood supply is hampered, right, the blood supply will be not going to this medulla oblongata, and it is the most sensitive organ, most sensitive for hypoxia. Hypoxia means lack of oxygen, and this center dies in less than 3 minutes. For your patient, it got less than 3 minutes. After 3 minutes, even if the patient survives, patient will be on ventilator. Yes, chest will be moving up and down. Right? The moment you stop the ventilator, gone. That's the reason that while left anterior descending, it is so dangerous, because it is knocking off the left ventricle, right? At the same time, it is knocking off this septal wall. So when the one side of the wall is collapsed and rest of the musculature is collapsed, who is there to push the blood? No one. Right? The death is almost inevitable. Full form is left anterior descending. Descending means going down, right? So that's the direction. That's the direction of this heart. It is on the left side. It is on the anterior wall, and it is going down. So that's why it is called as left anterior descending. Similarly, this particular artery, this one, right? It is called as the left circumflex. Circumflex is something which is winding around, right? So it is called as the circumflex. Similarly, there would be right coronary artery over here, and then there is other ones like circumflex. But this one is so dangerous, that's why it is called as the widowmaker. It's called as the widowmaker. If anything goes wrong to it, dangerous, very dangerous. So that's how everything you can see that physiology and say anatomy, everything is so much integrated, and this is where we are talking about the nervous system, right? So that's the whole idea behind today's session. All right. So I just saved this. I'm putting this file into our shared folder, so we'll get it within a minute. So thanks a lot. Wish you a very enjoyable, happy weekend, and see you very soon. Right? Next time we'll be talking about cell membrane along with the receptors. All right. Thank you and bye-bye. This PDF I'm sharing. I'm just putting it into that folder, right? Just within a minute. All right. Take care.